These were not failures of ignorant doctors. They were medicine's best defense against pain. A poisoned sponge held to the nose, a blade fast enough to beat the pain to the wound. One method put 300 patients to sleep without a drug, passed a government inspection, and was buried anyway, before its replacement had a name. The sleeping sponge. A dried sponge, its fibers soaked through with the juice of mandrake root, henbane, hemlock, and opium, sat ready in a brass vessel until it was needed. This was Bologna, around the year 1267. The surgeon holding it was a Dominican friar named Theodoric of Servia. Before an operation, he dropped the sponge into hot water for a full hour until it gave off a thick vapor, then pressed it against the patient's nose until the man went still. Physicians of the age called this narcosis, a drug-induced stupor, and believed the vapor traveled straight to the brain and shut off pain at its source, the way blowing out a candle stops the flame rather than the smoke drifting from it. A later review of the recipe called it a pseudo-anesthetic, capable of producing stupor, but not reliably blocking pain itself. Theodoric warned in his own writing that too strong a mixture could stop a man's breathing before the surgeon ever picked up his knife, and there was no way to measure the dose beyond experience and luck. The gap between stupor and danger came down to how much of the mixture the sponge had absorbed and released. Theodoric died in his early 90s, around the year 1296. The sponge outlived him by 400 years. Its effectiveness was never confirmed. Held down and counted. Jane Todd Crawford climbed onto a table in a log house in Danville, Kentucky on Christmas morning, 1809, carrying inside her a tumor that would later weigh more than 20 pounds. She had ridden 60 miles on horseback through the winter cold to get there, the swollen mass resting against the horn of her saddle the whole way. The surgeon, Ephraim McDowell, believed what most doctors of his time believed, that opening the abdomen was close to a death sentence, since no one yet understood how to stop infection. He operated anyway. McDowell gave her a dose of oral opium, though it did little to blunt what came next, and attendants held her still while she sang hymns and recited psalms through the entire 25-minute operation, the way gripping a steering wheel through a skid gives the hands somewhere to go besides the road. Singing worked as distraction, a competing task pulling attention away from the body. When McDowell finally lifted the mass free, Crawford was still breathing, still conscious, and still singing. She recovered fully and lived another 32 years, dying at 78. Later legend added a mob outside the house, ready to hang McDowell if she died. No record from the time confirms it. She survived an operation doctors of her own era had called a death sentence. Wine, cordial, and nothing else. 7 men in dark coats walked into a bedroom in Paris to perform what doctors called a mastectomy, removing the breast entirely. It was the 30th of September, 1811, and the patient was 59-year-old writer Frances Burney. A thin veil was laid over her face, but it was transparent enough that she could still watch. Through it, she saw a surgeon trace a line, a cross, and a circle across her chest with his finger, and she understood what was coming before anyone told her. Wine cordial was the only thing offered against the pain, and a cordial dulls awareness the way turning down a radio dulls the noise, without ever turning the sound off. She pulled the veil away and sat up to meet it. The operation lasted about 20 minutes. Months later, Burney wrote her sister a detailed account of the ordeal, the fear of waiting and the surgeon's silent preparations, an experience she said she still felt years afterward. Doctors of the era assumed patients were passive, something to be strapped down and managed. Burney refused the straps. Her husband had arranged the linen and bandages beforehand, and she read the surgeon's hand signals better than his own assistants did. She lived another 29 years, dying in 1840 at 87. The letter she wrote afterward became one of the few first-hand accounts of what that era's patients actually endured. Snow-packed on the limb. Physicians in 17th century Naples believed that if a wound could be made cold enough, the body itself would stop sending the pain signal upward, the way a hand goes numb after too long in ice water. The surgeon Marco Aurelio Severino used crushed ice and snow on a patient's limb in narrow parallel lines rather than one solid mass. The physician Thomas Bartholin later published the method in 1661. The narrow lines mattered, reducing the risk of damaging healthy tissue by freezing the whole limb at once. After about 15 minutes, the skin went pale, hard, and unresponsive, and the surgeon could cut without the patient flinching. 2 centuries later, A British physician named James Arnott revived refrigeration, deliberate numbing by cold, in Brighton, using crushed ice and salt to cool the skin far below freezing. In one case, Arnott described in his own writing, a 4-inch incision produced no complaint of pain at all. The trouble was depth. Cold could numb the surface, but reaching any deeper meant freezing more of the surrounding tissue, which kept the method useful only for smaller operations. Arnott kept developing refrigeration for decades and died at about 86 in 1883. The narrow lines he drew so carefully were never really about the ice. They were about how much of the body could safely be spared. 300 operations asleep. In 1845, a Scottish surgeon named James Esdale began operating on patients in Hooghly in British India using mesmerism, a deep trance induced by nothing more than his own hands. He would kneel close, moving his palms slowly over a patient's face for an hour or more, sometimes across several days before a patient was fully under. Doctors of the time blamed an invisible magnetic force with no evidence behind it, and most colleagues dismissed the practice as nonsense. 7 years earlier in London, John Elliotson had already lost his hospital post for the same technique, so Esdale knew what standing behind it could cost him. What was likely happening, later explanations suggest, was a trance deep enough to pull attention away from pain, the way intense concentration can delay noticing a minor injury. Esdale trained assistants to perform the hand passes while he handled the surgery, and reported close to 300 major operations this way. In 1846, Bengal's government appointed a committee to investigate his results. The report came back favorable, and Esdale was given a small hospital in Calcutta. He was in his late 30s. It changed nothing for long. Within 2 years, chemical ether reached India and did in minutes what Esdale's hands took hours or days to do. And a method that had just won government approval had no reason left to survive. Esdale died in 1859, around 50. Pressure on the nerve. 18th century surgeons already knew that a tight tourniquet could dull sensation in a limb, and a young surgeon named James Moore tried to turn that observation into a deliberate method for surgery. He called it nerve compression, squeezing a major nerve to reduce the pain signal traveling through it, and reasoned it might work the way pinching a garden hose stops water from reaching the far end. In 1784, at St. George's Hospital in London, the anatomist John Hunter tested Moore's compression device on a man whose lower leg needed to be amputated. Moore applied it the evening before, and numbness set in after about half an hour. The next morning, an assistant kept the nerve compressed for nearly an hour before Hunter picked up his knife. Moore reported a marked reduction in pain through most of the operation, though the effect was incomplete, and there is no record of the trial ever being repeated. The device never caught on in wider practice after that. Moore was 21 years old when he published the pamphlet describing his method. In 1809, he became director of Britain's national vaccine establishment, a long way from a leather pad and a steel screw. The idea behind his device was not wrong, since nerves really can be dulled by pressure. It simply arrived a century too early to be made reliable. The fastest knife. Robert Liston stood well over 6 feet tall in an operating theater packed with students at University College London. And by several accounts, before he began, he would nod to the students in the gallery, watches in hand, and tell them to start timing. His specialty was amputation, the surgical removal of a limb, and later accounts made his speed legendary, often placing the decisive part of an operation at well under a minute, though exact times vary across retellings. Speed served a practical purpose. In an age with no anesthesia, every extra second under the knife raised the odds of fatal shock or blood loss. The same way a bandage pulled off in one motion hurts less than one peeled back slowly. A later, more sensational story claimed one of Liston's operations killed the patient, an assistant, and a spectator all at once. No account from Liston's own lifetime supports it, and the tale only appeared in print over a century afterward, so it belongs with legend rather than fact. What is documented is what happened next. At 52, Liston performed England's first operation under ether on the 21st of December, 1846. Putting down the fastest knife in London the moment something better arrived. He died the following year. Speed had been his only mercy, for as long as it was the only one available. The gas they laughed at. It was sold as entertainment for 40 years before anyone took it seriously as medicine. The chemist Humphrey Davy had proposed nitrous oxide, the gas later nicknamed laughing gas, for surgery as early as 1800, writing that it seemed capable of destroying physical pain and might be useful during operations. But no surgeon picked up the idea. Instead, traveling showmen filled bags with the gas and let paying crowds inhale it for laughs at carnivals for decades, the effect fading as fast as breath fogging a cold window.
At one such show in Hartford in December of 1844, a dentist named Horace Wells watched a man injure his leg on stage and seem unaware of the pain. Wells had his own tooth pulled under the gas the very next day and felt nothing. Weeks later, in January of 1845, he tried to prove it in front of a room of Boston's leading physicians. The patient groaned during the extraction. The room called the demonstration a failure, and Wells left humiliated. Later accounts suggest the gas had simply been withdrawn too early to take full effect. Horace Wells died in 1848, at 33, without ever seeing the method redeemed. By the 1860s, nitrous oxide had become a major dental anesthetic, decades too late for the man who first proved it worked. The day the screaming stopped. On the 16th of October, 1846, 27-year-old Boston dentist William Morton carried a glass globe of ether-soaked sponge into the surgical theater at Massachusetts General Hospital, before surgeons who still remembered Wells's failed demonstration in early 1845. The patient, Gilbert Abbott, sat with a tumor on his neck. Morton held the globe to his mouth, and within minutes Abbott went still. Surgeon John Collins Warren began, braced for the scream that had opened every operation of his career. No scream came. The room stayed silent except for Abbott's slow breathing, the quiet arriving the way a live broadcast cuts to dead air mid-sentence. Later accounts put the words, "no humbug," in Warren's mouth afterward, though no eyewitness report records the exact phrase. A little more than a month later, physician Oliver Wendell Holmes wrote to Morton, proposing a name for the new state, anesthesia, meaning loss of sensation. The method that finally worked had needed someone outside the operating room just to name it. What followed Morton was less triumphant. He tried to patent the ether preparation under a made-up name, Letheon, and spent years fighting over credit before dying at 48. A country doctor named Crawford Long had used ether in surgery 4 years earlier, but had not published it. The silence in that Boston operating room, on one October afternoon, marked the end of nearly 600 years of searching. Which of these would you have been able to face? Tell us in the comments, and subscribe for the next story medicine tried to leave behind.